Let's take a closer look now at the trial and the drugs and the death. And for that, we're joined by Dr. Raphael Gershon, Chief of Anesthesiology at Atlanta's Grady Memorial Hospital. Doctor, thanks so much for being with us. The trial is barely underway. We haven't heard any of the testimony in the courtroom for the trial itself. But we have some sense from earlier information and from just the opening statements. What's your sense of how this is going and what that doctor did?
Well, I think there's a lot of information that's been out there for the last couple of years now, and I can't imagine there's any anesthesiologist or anesthesia personnel in the country who's not flabbergasted by the actions that are taken by Dr. Murray. It's the wrong person, using the wrong drug, for the wrong reason, in the wrong place.
Now, we heard briefly in that report, and we have it again, a short bit of tape of Michael Jackson on the phone to Dr. Murray. Let's listen to that.
He believed my show I wanted to say I've never seen nothing like this in my life. Go.
Would you give anyone who sounded like that more drugs?
Well, that's a very interesting question, and when you think about it, I hear people talking like this all day long. But I'm not in somebody's bedroom. This is how they sound when they're sedated getting the procedure. And sometimes, yes, you actually will give a little more drug, but it's given by a trained person. And they're getting a procedure. They're not being sedated for sedation's sake with this drug, which is incredibly dangerous, but they're having a surgical incision or they're getting a colonoscopy. They're getting something that will stimulate them, so therefore they need the sedation and they can handle the procedure. This is getting sedation for sedation's sake.
Well, and the defense would argue, this is the defense arguing that the doctor is not guilty of involuntary manslaughter, that Michael Jackson administered the drug at least partially to himself, that the doctor left the room and somehow Jackson ingested more of it along with another sedative that he was on. Would any doctor leave that kind of medication that close to someone they knew was a drug addict? And could someone kill themselves that way, the way the defense is alleging?
Well, so there's all sorts of different points that I can't imagine would have any relationship to reality. First of all, if the person's that sedated, they would have to have the wherewithal to start, injecting themselves more. Realize that he's lying there to be able to get Propofol.
Well, they say he drank it.
Well, we don't drink Propofol. We have it given intravenously. So therefore, what they're pontificating is that he injected himself more with the Propofol in his intravenous line. I would push back and say, did you have a special infuser? If you didn't have an infuser, that's already somewhat a malpractice in that own right. Was he being watched? Was he being watched through normal American Society of Anesthesia monitoring? Were they watching his blood pressure, his EKG?
What we know for a fact from what the investigators have found is that there was no special monitoring equipment and there was no special resuscitation equipment. How often do trained anesthesiologists use a drug like Propofol without those basic tools close at hand?
That would come under 0% of the time. We don't do that. And that's why, therefore, I think malpractice, for sure. But this is way beyond malpractice, which is why it's in criminal court. This is a criminal case. This was a criminal action. This is way beyond malpractice.
Well, I want to ask you about that because in the range of things that the court will be looking at is how much care did the doctor exercise? How much, I guess the exact word is circumspection. That would be if he was doing a good job at one end of the spectrum, and the other would be criminal negligence. I mean, from what we know already, this sounds very bad. It sounds like it's on the far side of the spectrum.
It sounds negligent to me. It's way beyond that. It's almost to the point where you have a loaded gun. I think of it, a loaded gun next to a 6-year-old child. You leave the room, they shoot and kill themselves, and you say, I didn't kill the kid. I mean, I think that's ridiculous. You set the whole thing up for this to happen. Okay, this comes as close to murder without actually pulling the trigger as you can. You cannot give this drug on top of other drugs, the benzodiazepines. They all act additively and synergistically, and you can't imagine that the person's not going to stop breathing. You cannot leave the room.
And the trial continues. Raphael Gershon of Grady Memorial, thanks so much for talking with us.
Thank you.